Podiatry, or foot medicine, is a branch of medicine devoted to the study, diagnosis, medical, and surgical treatment of disorders of the foot, ankle, and the lower extremities. Podiatrists practice in areas including surgery, sports medicine, biomechanics, pediatrics, orthopedics, and primary care, just to name a few. On today's special edition of the show, we'll learn all about why you need to take care of your feet. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned as we tiptoe through Healthy Connections. Physician associates foot and ankle surgeons treat a wide variety of foot and ankle conditions. To talk with us about that is Dr. Robert Duggan. Thanks for joining us.
My pleasure, Nat.
Let's define podiatry.
Okay. Podiatry is a medical specialty, and it involves the diagnosis, treatment, and in some cases surgical intervention for foot and ankle conditions. And it extends from the tip of the toes, sometimes all the way up to the knee. And in some of our athletes, we're looking at the whole mechanics of the lower extremity.
Now here in Florida, people wear sandals, flip-flops, open-toed shoes a lot. What are the problems that you've seen just from the lifestyle we have living in a warm climate that our footwear or lack of footwear cause? What are some of those problems?
Well, you know, from a foot and ankle point of view, we'd like to tell everybody kind of keep your feet protected. So a lace-up shoe, like a running shoe, is probably the best overall if you're looking at just kind of the general footwear. But flip-flops are a little bit dangerous, so I tell my kids...
Dangerous?
A little bit.
How so?
Well, they can catch on the surface that you're walking on. They have usually the one piece between the toes, and that can catch and create some irritation. It also exposes the foot to the conditions of the weather and the conditions around you. So if you're stepping in an ant pile, for example, you're probably going to get bit a little bit more frequently.
Well, what about people who say, but they're so comfortable?
They are. And, you know, that's a tough one to explain away. The problem that we have is that you can slide off the flip-flops, and so you can create some twisting and some injuries to that as well.
Are there some populations that you're seeing in your office more than others, say children or women who wear heels? Girls, we love our shoes. But what are some of the problems that can result? Let's start with the women. Okay. Because we love our shoes, we love our sexy high heels,
and
platforms.
pretty easy to to point fingers at the high heels.
Yeah.
One of the problems that we have is that as the heel gets higher, it forces the position of the knee to change. And so over a long period of time, you can get some joint changes to both the ankle and the foot joints, but also to the knee farther up. So I tell, even my wife, I say, the appropriate shoe for the appropriate occasion. But if you're going to do any long-standing walking, anything like that, you want to have a lower heel. And I know one of the things that we see is the fact that there's not a lot of ankle joint motion in our women that use heels a lot, consistently, day in and day out. It creates some tightness in the calf muscles. And if that isn't stretched or trying to maintain normal movement, then you can have some issues where it's more difficult as you come off the heels.
Okay.
And so you can get some
So you need to wean yourself down from heel height. So we've talked about the high heels. What about the flats, the other extreme? Because you're seeing shoemakers are getting the message that, we like low-heeled shoes that are pretty too. What are the inherent problems there?
Usually that's a much better shoe.
Okay.
So the lower the heel, but you really kind of want to prepare yourself. I tell everybody, kind of train for success. So if you're going to go from a heel, you want to gradually decrease to a flat. If you go from heels to flat very quickly, it'll be painful and sore. So you want to get your foot and your ankle and your leg ready for that. The flats are pretty good. One of the things that we see is that a lot of our women's shoes have a very narrow toe box, or it'll be a very shallow toe box so that there's not a lot of room for the toes in the toe box. So as you look for a shoe that maybe is a flat shoe, you want to at least look for a shoe that has a big enough toe
So you can
box
wiggle 'em
so
in
you
there.
can move. Yeah.
Let's talk about men. What are the problems that you see with a lot of your male patients?
One of the things that we see, especially in our kind of college-age to middle-aged men, is that they'll pick up activity again that they used to do, and we all think that we're kind of invincible, so we just kind of, go right into the same
Right.
activity, remembering the way it used to be. And so one of the things that I'll see is I'll see a lot of heel pain and Achilles tendon pain in our males.
Is that because of running or
It's usually because of a
being that
change.
weekend warrior?
A little bit of both.
Okay.
It's usually a change in activity. So if they start to do some running or walking, they'll notice a little bit of heel pain. They'll think that that's kind of normal, and they'll kind of push right through it. The guys have this, if a little is good, more is better, and they'll
Okay.
keep going. And so there are a lot of conditions where we'll see a change in activity, change in body weight, and we'll see this heel pain or Achilles tendon pain in our athletes that are older males.
So let's talk about the kids. They live in sneakers.
Yes.
Is that a good thing, a bad thing?
That's a pretty good thing. One of the things that I do see with our younger kids is they'll use shoes until they literally fall off their feet.
Right.
Or they won't tie the shoes, and so they fall off their feet. And both of those are a little bit dangerous. We want to make sure that there's enough room in the shoe, obviously, for the foot, but it needs to be secured so that the heel counter, or the back part of the heel, doesn't move
Okay.
without your
no
foot moving.
slipping up and down.
Right,
in the
because
back.
that can twist, and then you end up with an ankle sprain.
Okay.
And then the shoe that isn't tied is pretty much a loose bag of bones on the inside, so you don't have any security. So if you were to walk or had to move quickly or even step off a curb, sometimes you can twist and fall and injure.
So if you could give some advice to people, you're in your office and you're saying, "Oh, I wish more people would know this." Now's your chance. What should we know about taking care of our feet? I mean, we don't think about
Yeah,
them.
that's a really good question. I think probably the first thing is if you notice pain, that's not normal.
Okay.
Have your primary care doctor take a look at it. Come see us, whatever it takes to identify the fact that pain isn't normal. If you see spots where there's redness, irritation, certainly any bleeding or any wound injuries, especially if you're in one of those special patient populations where you have some vascular compromise.
Like diabetics.
Or diabetics especially. Come see your physician or us and let us find out why you're getting that condition and if it is something that is serious. The other thing is that you really want to kind of prepare for success, like I said before. And so that a lot of us, we live in Florida, it's a beautiful area that we live in, and you want to be more active. Get yourself ready for that.
How do you do that?
Well, everybody says that, make sure that you have a physical before you do any activity. I think that's a great idea. Make sure that you get the Good Housekeeping seal of approval from your physician.
Okay.
And then you want to go very gradually into your activity. I tell our patients, I'm an old athletic trainer too, and I tell them you want to condition for the event, not use the event for conditioning. So
I like that.
So
Okay.
work your way into a running program. Work your way into, a swimming program. Swimming's
So
great.
just take it by degree.
Take
Don't
your
jump
time.
into the deep end of the pool.
Exactly.
Okay.
Exactly.
Barefoot, good or bad?
Probably okay if you know the surface you're walking on.
Okay, because there's a lot of asphalt, there's concrete, there's,
Yep.
we've got beaches, we've got grass. So should we be wearing shoes more often than not, even at home?
I think so, especially as time goes on. If you know that you're getting irritation or pain because you have hardwood floors or concrete or tile, then you probably want to protect your foot.
Okay.
Over time, we lose some of the hydration or the moisture in the bottom of our foot. We lose some of the plantar fat pad. So we don't have the protection going forward as we did it when we were
Which is
younger.
why some shoes aren't as comfortable
Yep.
at some point than others.
Yep.
Okay.
So think about the surface that you're going to walk on and try and prepare for success.
Just use a little common sense. If it hurts, that's not normal.
That's not it.
Dr. Duggan, thanks for being with us. Great common
Thanks,
sense
Annette.
tips. And we will be back right after this. With us now is a patient of Dr. Duggan's, Deb Nickerson, to share her story. Well, we can tell everybody you walked into the studio just fine, but it was not that way back in January. What happened?
I was running through the state park. I like to do off-road running. I was on the trails, and so there's lots of roots, and we turned some corners. I cleared some roots. I didn't fall, but I came directly down a root that was sticking up under leaves and such, and it just hit my heel, and that's how I got the injury when I was running.
But you didn't stop and say, I
No.
need to have this checked out.
No.
What happened?
I think that's the mentality of athletes or runners and such. For about 2 weeks, I continued to either try and run on it or walk on it, and it was inflamed, swollen. Finally, I ended up deciding, thinking that I can't get it to heal. I tried the ice and everything. Went to Dr. Duggan, and he checked it out and said, "Oh, you've done a number on it." So after seeing him and him x-raying and doing all those things, I ended up in a boot. So we took the boot route for a little bit.
But that heel bone supports everything.
Everything.
So how successful was that, just wearing that boot?
Because the heel bone does take all of our body weight, we thought the boot would be the first route to go. It got me up a little bit off of it, but yet I was still able to be mobile because I am pretty active. I teach school and such, so I'm very active. But after about, I don't know, a couple of months of being in the boot, the heel was not getting any better.
And so what was the next step?
I went on some crutches to try at least to alleviate being on the boot all the time. Went and got an MRI at that point, and the MRI just showed that it was a mess.
I can tell from your face that it was not
a
good
mess.
news.
It was a mess. Dr. Duggan said actually that it was like a hammer had hit my heel.
Wow.
So, and then of course everything around the heel bone became inflamed, and the tendons, everything was all inflamed because I was up on it. So at that point, that's when I had to hit the scooter.
Okay.
So, and that was a challenge for me, just because I don't know if you've seen the scooters. They're
Where you're on one knee?
Yep, one knee is bent on the scooter, and I'm just kind of rolling along. It's almost, and you just kind of ride it like you would if you were a kid riding a scooter.
Now you teach 9-year-olds, so
Yes,
they
I
had
do.
to love that.
Yes, they wanted to ride the scooter every day. My team actually at school bedazzled the scooter. So, yeah. And then I also had to, it allowed me, at least the scooter allowed me to be mobile and not have the pain because the foot was up off the ground. I also coach running, so I was able to at least be out with my athletes to do that as well.
So if there's someone watching now, a runner, and I've got to run, and they have a problem similar to what you did, or maybe not as severe, but they're gonna tough it out. I can diagnose this. I know my body. I don't need to go to the doctor. What would you say to them?
Well, that's pretty much every athlete I know,
Right.
of course, and even the ones that I coach. We have to listen to our bodies. And this is the first major injury I've had involved
How long
with
have you
my
been running?
Oh, forever, since
Okay.
I was in high school. I
Okay.
mean, forever. Did triathlons, running. So I've always been active and involved in it. So of course, I didn't listen to my body, which I always tell my athletes, listen to your body. And especially with the heel, because it takes, with running, I mean, walking, it takes all of our body weight. And every time I would walk, I just pulled on that bone, pulled on that tissue again and again, and it made it worse. So it's kind of compounded and made my healing a lot more difficult. So I would encourage anyone who has an injury to their foot, they go and see their doctor right away so that they don't inhibit them running earlier. You know, I haven't run since January.
So when do you any idea on when you might be able to get back out there?
Well,
are you a little scared?
A little bit, a little
Yeah.
bit. I'll have to start out nice and slow. I'm hoping Dr. Duggan says in July. I've been going to a physical therapy that's kind of unique. It's called Alter-G. It's zero gravity, and basically what they did was they zipped me into a machine that was on a treadmill, and it fills up with air. So my bottom half of my body is actually weightless. So
you are walking on air.
so I could actually, at that point, I would come in on my scooter, they'd put me into the machine, zip me all in, and then I would actually become weightless. And so I could actually walk on the treadmill, and they could reintroduce weight to my
Gradually.
heel. Gradually. So they can
Okay.
control the amount or the percentage that was actually being applied to my heel.
Okay. I bet you appreciate your feet a lot more.
Oh, yeah. Oh, yeah.
We want to let her, she broke a new milestone today. This is the first day she's had on heels. You walked in with
I
heels.
Did. Now, just in case my PT's watching, I only walked from this
Not
parking lot.
really high heels. They're not really
no,
high.
no.
But Deb, thanks for sharing your story.
You're welcome.
And the reminder to
Yes.
athletes, don't ignore what your body's trying to tell you, because you
Absolutely.
can make it a lot worse. We're
Absolutely.
glad you're going to be out there running on the
Thank
trails again.
you.
Good
Thank
luck, and
you.
thanks for sharing your story with us.
Thank you.
Don't go away. We'll be right back. They serve us well, but we think about them all too little. They're our feet. But today we learned on Healthy Connections that we have to take care of them so we can be around and enjoy all the wonderful things a state like ours has to offer. I'm Annetta Wilson. Thanks for joining us, and we'll see you next time on Healthy Connections.